Welcome back, friends. So in the first part of the diagnosis we have talked about Widal test details, right? So now this is the part 2 of the diagnosis of the typhoid. So let's start. So first of all, we can do blood culture. We can perform specific serological tests. Let's say we can identify salmonella antibodies or antigens with the help of fluorescence antibody studies, okay, that look for substances that are specific for typhoid bacteria. We can perform Widal test and ELISA also, okay. We can perform urine and stool culture that is taken during the second and third week. Marrow culture can also be done by taking culture from CSF, peritoneal fluid, mesenteric LNS. So mesenteric is the fold of the membrane that attaches the intestine with the abdominal wall. It is the folds of the membrane that attaches the intestine with the abdominal wall. Okay, there can be inflammation in that mesenterics. Under such circumstances, cultures is taken from that mesenterics and it is performed in the lab. Okay, resected intestine, gallbladders, pharynx, tonsils, and abscess bones. Okay, so the marrow culture have 90% sensitivity result unless or until after 5 days commencement of the antibiotic. Okay, and punch biopsy of samples of rose spot culture. Remember, during the time when I have talked about the symptoms of the typhoid, we have told you that the rose spot will going to play an important role in the diagnosis of the typhoid, right? And here it is. So this test is 63% sensitive, and we can also perform clot culture. Okay, so that is all about the diagnosis of the Salmonella typhi infection. So now we have one videos left for Salmonella typhi where we will going to talk about the treatment. Okay, so thank you for listening to this class.